Once again, thank you guys so much for being here. I always like to encourage and applaud patients for taking that extra step to come in and learn a little bit more about how to improve your health. So good job, guys. Way to do that. I want to start with just giving you some tips. And how many people looking at this are already overwhelmed by diet, nutrition, right? It involves a lot of lists, right? Of checkoff lists of things you have to do, right? But my hope for tonight is that I can simplify that for you. And we're going to do that by really focusing on these two main areas, because really everything else in blue is kind of summarized. You heard Dr. Golden talk about balanced diet. So I really want to focus on that. What does that mean exactly to have a balanced diet, right? So we're really going to focus on that. And then adding more movement. You've already heard a little bit about that, so I probably won't spend too much time on it, but I cannot stress to you the importance of that. Our bodies are made to move, and when we don't do that, bad things happen, all right? So we're really going to focus on these two things, but like I said, we'll hit these other points as well. So how many of you have seen this before, right? This isn't new. It's been around for a while, and it's the MyPlate method, right? And what you notice here is half a plate, or a majority of what is on the plate, is non-starchy vegetables, right? But the carbohydrate is still there, all right? And if we're going to talk about balance, and as complicated as it can get, this is how we keep it simple, right? We look at a plate, we look at your food, and if you're able to understand and basically identify the foods that we really want to minimize compared to the foods that we really want to maximize, then you're able to achieve that balance. But if you have no idea what these foods are and kind of what foods fit in which category, then it's going to be really difficult to achieve that balance, okay? So that's why we're going to kind of start by breaking this down a little bit further. But keep this in mind. And as you keep this in mind, I also want you to kind of start picturing, or maybe, imagine or think about maybe some of your past meals. Maybe some of the food that has been typically on your plate compared to this, all right? And it's not a judgment, it's just where are you at now? Because you have to really look at where you're at now to better identify and kind of point out what might need to change. So there's three main nutrients in food: carbohydrate, protein, and fat, and that's what we're gonna spend most time on. Carbohydrates. You heard Dr. Golden talk about blood glucose, right? And when it comes to blood glucose, a good portion of that, other than what comes from our liver, comes from carbohydrates. You heard her talk about insulin resistance, right? And I'm going to get back to that, but when it comes to diabetes in particular, as well as just overall weight gain, a lot of our calories come from carbohydrates. And it's not that we cannot have them. This list is not a list of foods you cannot have, but it's a list of foods you have to be aware of. It's a list of foods that you have to be able to look at and again, decide for yourselves, am I eating too much of this compared to the other categories of foods we're going to talk about? The foods in red are those complex carbohydrates Dr. Golden mentioned. Those carbohydrates that are more full of fiber and other nutrients, other vitamins, that are actually giving your body more of what it needs, as opposed to just requiring your body to produce more insulin. Okay, so we're gonna bring this all together. But again, looking at this list of foods and picturing that plate, are you potentially eating too much of this category of food? Is there room to potentially, again, bring down those portion sizes of this area of foods? Protein. And protein and fat are somewhat combined. But when it comes to protein, we really want to choose lean proteins. Proteins such as skinless chicken, turkey, lean pork, lean beef, fish, 2 to 3 times a week if possible. salmon, lake trout. It's the reason is because those are, those contain more of our healthy fats. Has anybody ever heard of the Mediterranean diet, right? So again, it's focusing on those healthier fats, and that's why we want to definitely include some fish if possible. We want to limit our red meats, the fattier cuts of beef and lamb and pork, and then avoid those processed meats. And this is the hard part. You're going to hear me talk about processed foods a lot because unfortunately it's become more of a staple in our current American diet than it really should be. So we really want to avoid those deli meats, ham, bacon, pastrami, salami, hot dogs, pepperoni, and there's a couple reasons for that. One of the reasons is, yes, they are packed full of fat, but they are also contain very high amounts of sodium as part of their processing. They do have a lot of sodium, which we're going to talk about in a second. So talking about proteins is a good segue into our fats. And I've really, again, simplified this to our saturated fat and unsaturated fat. You've heard a couple of the doctors mention tonight LDL cholesterol, right? And especially for people who have diabetes, really wanting to reduce our LDL cholesterol. And yes, there is medication that can help us do that, but you can also do that by choosing those healthier fats, right? If you look over on the right-hand side, the list of foods that have more of our unsaturated fats as opposed to the saturated fat. I also like to simplify this by thinking, okay, it's not like you're going around thinking, okay, is this saturated or unsaturated? But one easy way to really differentiate the two is our saturated fats most often come from animal products. It doesn't mean that you have to become a vegetarian. But again, if you think to yourself, oh, I ate an animal, product for breakfast and for my snack and at lunch and at dinner, chances are you're overdoing the saturated fat, right? Another way of thinking about saturated fat is they're solid most often at room temperature. Think about butter, right? If you leave it on a table all day long, it's not just going to melt, right? You have to apply heat to that. So a lot of our saturated fats are solid at room temperature, whereas our unsaturated fats, olive oil, peanut oil, right? Those vegetable oils are liquid at room temperature. So that's another easy way to help differentiate the two. Sodium. It's a tough one because, again, in all of those processed foods that we have come to know and love, that is where the highest percentage of our sodium intake comes from. It's not actually from the salt shaker. Yes, we do need to be aware of it, but it doesn't all come from there. I was amazed to find that even though the recommendation for sodium intake is, less than 2,400 milligrams, even for a lot of us, especially people who have certain risk factors, less than 1,500 milligrams, the average American eats more like 3,400. So you have to be intentional about this, okay? We have to be intentional to help reduce our sodium intake. The salty six, and I'm just going to put these up here quickly. And go back. Bread, a lot of people don't realize, but something like bread, we all eat a lot of. Like, you don't even probably think about the number of times we eat bread. And there's not huge amounts of sodium in one slice, but if you're having multiple slices a day because sandwiches are your go-to, then it's something you have to be aware of. Those deli meats come up again, right? Not just for their fat content, but again, this is where the sodium comes in. A pizza, and trust me, I am a New Yorker. I love pizza just like the rest of us. But a pizza kind of has everything combined, all those high sodium foods combined, much like a sandwich, right? And then you're probably thinking, why is chicken up there? Well, chicken is a very common protein for a lot of people. And because of that, and because it can, it's on the cheaper side when it comes to animal proteins, we like to doctor it up. And we doctor it up with all those different seasonings and sauces. And it's those things that tend to be higher in sodium. So you have to really watch that. So I go back to this picture, right? And even though I know I covered a lot of information in a very short amount of time, I'm used to having an hour to present this information. This plate really, again, it encapsulates all of that. If you're eating majority of your food being non-starchy vegetables, it can't be super high in fat, right? It can't be super high in sodium. It's not going to be too high in carbohydrate, right? Notice even in the carbohydrate portion, yes, white rice is there. Because I really want to point out, and it's something that has been mentioned before, this is all about a sustainable lifestyle, okay? And I want you guys to be able to make these changes and continue these changes. And that means we have to start with where you're at. And if currently, if you're honest with yourself, the majority of your plate is white rice, to ask you to just completely move white rice and move in the quinoa is a little unrealistic, right? But if I just ask you to, let's start with just cutting down the portion of white rice and increasing those vegetables that you like, that's a bit more doable, right? And we can focus on making those healthier carbohydrate choices later, but really start with looking at the portions of the foods that you're eating, focusing on those lean proteins and getting as much vegetable as possible. I just want to mention something that has already been mentioned, but 2.5 hours is the current recommendation. All right. And here's kind of the maybe the stab to the heart moment. But does this sound like a lot or a little to most people? Little. Good. I'm glad. Because the next question kind of brings it home. If it sounds like maybe a lot, or if you've told yourself, or you're kind of in that cycle of maybe not exercising very much, or, oh, I don't quite have time. How much television do you watch a day? Right? Okay, and maybe TV's not your thing, but how much time do you spend on social media? Or on your computer? Or chatting it up with friends? It's not that any of these things are bad, but these things often take priority over something that is vital for our health, right? And has so many benefits. So it's one of those moments in times to really just be honest with yourself and really work to make this a priority in your life. I'm a huge fan of goal setting, but we have to set realistic goals. I'm also, and my husband is the first to say this, I'm a planner. And a lot of us are, but especially when it comes to exercise, especially when it comes to these lifestyle and dietary changes, you have to have a plan. Because if you're just trying to wing it, chances are it's not going to work, especially because we're talking about habit change. So make a plan for yourself. Write it down. Tell somebody about it. That accountability is really important. It's almost like when you say it out loud, it makes it real, right? Say it out loud. Say it to somebody else to make it more real, and you're then more apt to actually follow through with the action, which is what is the most important part. I'm not going to talk a whole lot about weight loss just for sake of time, but all of these things are what leads to the weight loss, right? And you've already heard Dr. Golden talk about that insulin resistance. But as we're able to kind of give our body a little bit of, almost like a little bit of a break, right? Give those beta cells, those insulin producing cells, a little bit of a break by reducing our caloric intake and then exercising, which helps with that resistance, and then leading to weight loss. Again, we're talking about benefits, not just in diabetes management or prevention, but for hypertension, reducing your cholesterol, right? So it carries over into every area of your health. And we're not talking about huge numbers. 5 to 7% is incredibly effective at both prevention and management. So just to wrap up, again, really the focus is overall achieving and maintaining that healthy weight, but we do that by eating a well-balanced diet, moving more. Don't get caught up in that checklist. Really, and again, I'm a visual person, so that keep that plate in the back of your mind, and you're really going to be hitting all of those points.